Early childhood education and our earliest learners is a little bit of what I want to discuss today. I'm a strong supporter of our earliest learners, and I know we just had the Start Strong campaign, now focusing on children, birth to 3 as opposed to just the 3 and 4-year-olds, and quality child care goes into that mix. So one of the questions I have is, in the proposed budget, the administration proposed using federal funds to pay for the increase in the minimum wage. It's about a $74 million line item from federal funds. So I guess one of the questions I have is, can you share your calculations with the committee regarding the $74 million?
Sure.
You're going to be providing it to us, or
I can, or I can give you a high-level explanation of how.
Can you give me a real brief?
arrived at
Because I
that?
have a couple other questions.
Sure. So what we did was we looked at the Department of Labor and Industry's survey for annual wages for childcare workers. I believe the hourly wage was an average of $10.42. And so we estimated the amount of kids in subsidized care and the amount of rate differential that these providers would need to make up, and arrived at the $74 million estimate.
So what happens next fiscal year? Will you continue to supplement that with the federal dollars, or will that go away next year?
Those costs will have to transition over to state funds, and as part of the package for the minimum wage, we are achieving savings through transitioning adults off of medical assistance, and also savings from transitioning children from Medicaid coverage to free CHIP coverage. So with those savings, we would be able to fund the $74 million with state funds.
So do you have any concerns if the minimum wage does increase, families that are currently not using any state dollars or any subsidies to pay for their child care? Are you concerned that they might have difficulty paying for child care going forward if the providers have to raise their rates to cover this cost? Is there a safety net there, or has that been calculated, or is that a concern?
Yeah, I think it's definitely something to be mindful of. I think the extent to which that will actually impact providers will really depend on the industry. I think providers should expect to see some savings. There are a lot of turnover in those childcare positions, and so through savings and efficiencies, through decreased recruitment and retention efforts and training employee after employee, they should be able to garner some efficiencies as well. But I think we have already been contacted by the IFO. I understand this chamber asked the IFO to analyze the impact of the minimum wage, and we're happy to discuss it further with them.
So, I belong to the Early Learning Commission in our local area, our Tri-County area, and we've been doing assessments on our child care providers. How do we get them to start at 3 and 4? How do we help them become more professional? And one of the things we quickly realize, you normally don't get into providing child care to become very wealthy. It's a hard business model. And, we've been working with the Small Business Development Center trying to come up with a model to help the child care providers. And our child care providers sometimes can't pay for the materials that you want them to have to become Star 3 and 4. They can't pay for toner for their printers. So we're a little concerned if we're struggling now, what will happen if there is an increase. And a lot of parents who teeter on that fine line are very concerned that we're going to be without childcare and there'll be nobody to help us. So I just want us to be mindful going forward that could be a concern. And then the other question I have is, if the minimum wage does not go up this year, the allocated $74 million, what would you spend it on if you're not using it towards that?
Yeah, we would have to go back and look at that. I would assume that in future years we'd continue to invest in waitlist slots, we'd continue to invest in quality, but our goal for this budget cycle is to really begin to lift people out of poverty, and that is our primary focus and why we're choosing to invest the $74 million in that area.